Hello, my name is Alyssa Rice, and today our group will be discussing with you the topic of the obesity epidemic. Did you know that according to the International Journal of Obesity, 1 out of every 3 children and 2 out of every 3 adults is suffering from either being overweight or obese? With this staggering statistic, it is likely that you or someone you know or love is suffering from a weight issue. Our group has spent a fair amount of time researching this topic as well as possible solutions to this growing problem. Through research, it is our belief that since obesity is a progressive condition which results in multiple health issues, prevention through education is the most effective and economically beneficial option. In this video, we will be discussing the origins of obesity and how the problem has changed since past generations, local opinions and programs for obesity here in Kentucky, government involvement in global obesity, government involvement in U.S. obesity, and lastly, individual rights and reasons why the best solution does not include government involvement. To find a solution, you must first begin at the root of the problem, but first, let's watch this short video.
Whether a person needs to lose weight is determined by the body mass index, or BMI. It's calculated by dividing the weight of the subject by the square of the height. A BMI above 30, the subject is considered obese.
The Future Diet Report analysed existing data on global obesity rates. It found in 1980, 1 in 5 people were overweight or obese. In 2008, it had risen to 1 in 3.
I guess there were 2 take-home messages. The first is that obesity prevalence today is about 34%. We're predicting that to go up to about 42% by 2030.
Issues that are confronting this country and now increasingly the world, this could be the #1 issue, both in terms of human misery, the severity of the disorders that are consequent to it, and at the cost of this enormous problem.
Obese people are more likely to develop heart disease, stroke, diabetes, and even cancer. And now researchers say obesity also increases your risk for death.
It's well recognized that there's a strong link between obesity and type 2 diabetes.
Someone who's obese costs on average more than $1,400 to care for more per year than someone who's not obese. Someone with diabetes costs on average $6,600 more to care for per year than someone without diabetes.
Like if you look at the cost, as things stand now, about $147 billion a year. You break that down specifically in childhood obesity per year, $14 billion. What's projected to happen over the next 8 years with obesity, and specifically as a country, 21% of total medical costs due to this somewhat preventable problem.
Yeah, and it is a complex issue because we've dealt with poverty, we've dealt with all of that before, but we're still seeing this spike, it seems.
As you just witnessed from our short media project, the obesity epidemic is a growing problem that is making national headlines, and a solution needs to be found. No matter if you're tall, short, big, fat, skinny, if you are a consumer of food, this obesity epidemic has the potential to affect you if it hasn't already. In fact, according to the Pew Research Center survey, 63% of U.S. citizens say obesity has consequences for society beyond the personal impact on the individual. Growing up in the prime of this obesity epidemic, I have witnessed many of the causes of the obesity problem firsthand, both as a child and as a young adult. The origins of obesity can be narrowed down to three basic causes: an increase in pace of our lives, a lack of knowledge, and a lack of physical activity. Today I will be discussing with you these causes and how they have changed over the years. Let's begin with first by discussing the fast-paced, busy lives we live. One of the first causes of this obesity epidemic is busier schedules and the overall increase in pace of life, leading to the consumption of more fast food meals and higher amount of calories. As college students, we are all pretty aware of how hectic a day can be, and finding the slightest bit of time to fit in a meal can pose itself as a challenge. With the increase in industrialization, it is fact that the world is simply moving at a faster pace than it was in previous generations. According to Pew Research Center, on a global scale, obesity is overwhelmingly a problem in developed nations rather than developing nations, as seen in this map. From the newest technologies to the latest fad diets, the new trend of the world is the faster, the better. However, following this trend has presented some problems, and people have begun sacrificing quality for convenience. For many adults, balancing family life and full-time job does not leave much time for free time. Unlike past generations, many women are now working outside of the household. With cases like this increasing where both parents are working full-time, there is becoming less and less time for household responsibilities such as cooking. According to Pew Research Center, among those with children under the age of 18, 40% of working mothers and 34% of working fathers say that they feel rushed all the time. In addition to lack of time, there is also a lack of knowledge when it comes to nutrition and living a healthy lifestyle. Another reason the obesity problem continues to grow is because many people lack the knowledge they need to reduce or prevent the problem. By learning how to eat healthier and the effects exercise has on preventing health risks related to obesity, one can gain the ability to make better educated decisions about their health. As portion sizes have continued to get larger over time, consumers have become unaware about how many calories they are taking in, leading to overconsumption and weight gain. This is noticed as a problem, and steps have been taken to prevent it by having restaurants label the amount of calories contained in an item. Additionally, many people feel as though they are getting a bargain, more food for their money, and are having trouble turning away the extra food. Another way this lack of willpower affects people is their inability to begin and maintain a regimen of healthy activity. As mentioned previously, the origin of obesity can be narrowed down to three basic causes: an increase in the daily pace of our lives, a lack of knowledge, and a lack of physical activity. Today, I have discussed with you the origins of obesity, as well as how the obesity problem has changed over the years. Whether we like it or not, the obesity epidemic is real and it's here. And unless we decide to take action immediately, an unhealthy future lies ahead of us. I am asking you all today to take the time to become better educated about your health and exercise before it's too late. Now that you have a better understanding about the main causes of this obesity epidemic, Katie will now talk about local opinions and programs for obesity here in Kentucky.
According to Carter from the Courier-Journal, Kentucky has the 7th worst obesity rate, which means that about 31.5% of the population is obese. As Kentucky residents, we should care about our increasingly high obesity rates. Through my research, I have learned that the biggest factor in obesity is uneducated individuals in rural areas. There are, however, various solutions that can prevent increasing obesity rates in Kentucky. Today, I'll discuss the obesity rates in Kentucky. I will mention what will happen in Kentucky if obesity rates continue to progress. Lastly, I will mention what we are doing to solve this epidemic. Let's look at the current obesity rates in Kentucky. Kentucky continues to increase its obesity rates with increasing health awareness. Thus, the obese population seems to be in denial. According to Rahm from the Atlantic Journal, a new study in the Journal of the American Academy of Nutrition and Dietetics revealed that the parents of obese children are in denial about their kids' weight even after a doctor's diagnosis. Also, according to the CDC, more than 40% of obese kids are unaware that they have a weight problem. Kentucky's adult obesity rate has increased from 12.7% in 1990 to up to 30% currently. Childhood obesity has also increased to almost 20%. Kentucky's youth drinks the most soft drinks in the nation, which is about 89 gallons per person. And studies have found that 1 in 3 children will develop some form of type 2 diabetes in the future. Now that I've discussed the obesity epidemic in Kentucky, I will now discuss the consequences of an uncontrolled epidemic. The more processed fast foods we consume, the more we are at risk for obesity-related conditions such as heart disease, high blood pressure, and type 2 diabetes. How many of you have relatives with diabetes, heart disease, or high blood pressure? These health conditions all stem from obesity and could be the future of the obese population in Kentucky. Now, without education of a healthier diet, Kentucky's obesity rates will lead to more obesity-related health conditions in the future. Currently, 39.1% of Kentucky has hypertension, while 10.6% has diabetes. As a result, programs like Kentucky's Obesity Prevention Program have created more farmers markets and double-dollar programs to improve access and prices to healthy foods. But the solution can only be found through educating adults and children. The emphasis should be on educating the younger generation so that they can help themselves and their future children. The expansion of programs such as the Childhood Obesity Intervention Program, like the National Early Care and Education Learning Collaborative Project, is the best way to educate Kentucky on how to prevent future obesity. Children's parents and even schools can help teach kids how to eat healthy. These are the leaders who have the most impact in the children's lives. Kentucky was one of the many states that implemented the Healthy, Hunger-Free Kids Act of 2010, which limited food options to only those approved by the USDA. Kentucky also has implemented farm-to-school programs that have shown to improve students' nutritional intake. Also, sugar-sweetened beverages have had taxes so that they will result in less consumption for the state. In conclusion, there are various solutions that could prevent increasing obesity rates in Kentucky. Today, we discussed several solutions for the high obesity rate in Kentucky. The obese population needs to address their problem and no longer be in denial. Less processed and fast food needs to be consumed, and more education programs need to be implemented. The next time you are faced with the decision between an apple or a candy bar, make the healthier choice. You will not only want to eat healthier, but you may convince those around you to do so. And now we will have JQ talk about the government involvement in the United States. Thank you.
Did you know that 1.1 billion people worldwide are obese? An astonishing 1.7 billion people are at risk of developing weight-related illnesses. As brothers, daughters, mothers, and fathers, we should all be concerned about our lives and what we can do to extend them. Through research, I've found that other countries have found many different successful methods of combating obesity. Hard work, determination, and strict guidelines, along with a strong plan, is the first step to combating obesity. Today, I will talk about what I've learned in my research of how other countries have found success through government regulation. Let us begin by discussing Japan's strict metabolic regulation. According to Lawler in the 2009 San Diego International Law Journal, in Japan they are using the metabolic legislation to combat obesity. The metabolic legislation requires that all Japanese adults must take an annual health screening to detect illness or obesity, or even if you are at risk of becoming obese. Japan also guarantees access to health insurance for everyone. If you are found to be obese, the Japanese government uses the Metabo legislation to provide you with the opportunity to be given lifestyle counseling. You are also given the option to have a specifically trained nurse provide active support by setting up a customized diet and exercise plan. If you are deemed a risk for obesity, you are provided motivational support through counseling and encouraged to diet and exercise. The government pays for the elderly's health care while giving fines to the health insurance providers who show either low rates of participation in the program or who are unable to adequately reduce the rate of obese patients. They are also punished by being forced to pay an extra 10% toward the healthcare fund for the elderly. Now that we have discussed the strict nature of Japan's obesity regulations, we will turn to Europe's steps towards combating obesity. According to Hyde in his 2008 article, Europe Battles with Obesity, featured in The Lancet, Europe has been forced to acknowledge that over 50% of adults in Europe are obese or overweight, and they are taking action. In some regions of Europe, 3 times as many people are obese today than in the past 20 years. Even the children are fighting obesity. Astoundingly, 10 times more children are obese than in the 1970s. Sweden and other European countries are fighting the urge of unhealthy foods that contribute to childhood obesity by banning commercials targeting children 12 years of age and under. Europe has begun color-coding labels for any food or drink product advertised as low-fat, diet, low sugar, or anything deemed good for you. The label colors are green, amber, or red, depending on the amount of fats, saturates, sugars, and salt the product contains. The government in Germany has started recently holding drives to promote physical exercise and good health. Also, a new holiday has been put in place called the Day of Health, Food, and Cooking to promote individuals to eat better. Director General of the National Public Health Institute in Finland, Pekka Puska, has encouraged dairy farmers to incorporate berries in the diets of their livestock for their homemade cheeses, butters, and milk. By 2000, the levels of heart disease associated with obesity dropped by 73%. In conclusion, many countries around the globe have successfully imposed regulations regarding the food intake, exercise, and the mindset of combating obesity through various methods. As discussed, several countries are successfully combating obesity via government regulation. From Japan's Metabo legislation requiring health screening, providing everyone at risk with health counseling, and finding non-compliant health providers, to the many methods discussed in Europe, such as color-coding labels and banning commercials promoting unhealthy food targeting children. Upon learning how other countries have successfully found methods to combat obesity, I am hopeful that the United States can also find its own way to combat its obesity epidemic. And now, JC will discuss the United States government involvement in dealing with obesity.
Thank you, Ryan. As the most obese country in the world, the US government spent $147 billion in obesity healthcare in 2005. And as the rates of obesity keep growing and costs associated with obesity has become enormous, some policies like soda tax and other food and nutrition policies have been made by the US government to combat obesity, and these policies highly affect US residents' daily life. Through my research, I found that the US government put a lot of effort into it, and there were several key policies have been made. So in this section, I will discuss the effect of obesity prevention strategies made by the US government. So let's begin with obesity healthcare in the US. As mentioned above, the US government is spending enormous sums of fundings in order to defeat obesity. And obesity-related illness includes stroke, heart disease, type 2 diabetes, and cancer. Annual healthcare costs of obesity-related illness are between $145 and $210 billion. Which is nearly 21% of annual medical spending in the US. Meanwhile, there are about $14 million spent on children obesity-related medical expenses. Also, obesity as a chronic and complex disease, it would make people immobilized in traction. As a result of immobility, the expense of disability pensions is getting higher and higher, together with the incremental medical costs related to obesity. Secondly, the US government also wrote several nationwide food and nutrition policies against obesity. But unfortunately, some of these policies, such as calorie labeling, did not make intended effect of either the decreasing of obesity or even just promoting a healthy lifestyle. Beverage and snack taxes have been put into effect in more than 33 states over the nation. The beverage tax would rise close to $1 billion of revenue. However, some people argue that the soda taxes or the beverage taxes are too small to make a substantial effect of some consumption of the sugar-sweetened beverage. Well, last but not least, children and adolescents who are obese are likely to be obese when they come into their adulthood. According to WMC, in 2011, 12,000 schools are in the Healthy School program that intended to reduce childhood obesity by the year of 2015. But it's helping children to have a healthy diets and get more and more physical exercises as they are the part of the program. And by developing the curriculum, the program was designed not only just prevent the children from being obese, but more importantly, the program was aiming to help the children's entire family to adopt healthy habits. In conclusion, the US government has developed several approaches to reducing obesity. In this section, we discuss the US medical expenses of obesity epidemic and educational methodologies against physical inactivity and also the poor dietary habits. But many people believe that excessive government control over the obesity program could produce grave consequences. So now let's welcome Brittany, and she will discuss individual rights and the solutions with and without government involvement. Thank you.
As Americans, we are granted the rights to freedom of speech, religion, press, assembly, and petition. If the government regulates what we eat, wouldn't that be taking some of the freedom? As consumers, it should be your choice on what to buy and consume. Even though the government has good intentions for food regulation, it is ultimately up to us as Americans to lead a healthy lifestyle. In this speech, I will talk about why the government should not interfere with our nutrition by adding laws and regulations. I will look at past government attempts to force citizens to make healthy choices and how those attempts were ultimately unsuccessful in the end. Then we will discuss how leading a healthy lifestyle is up to you because of your free will. So far, government interference has been unsuccessful to lower obesity rates, so maybe that is not the way to go about this issue. Mexico has implemented taxes on junk food, and also in schools they have to serve healthy foods and only healthy foods. Unfortunately, that has been unsuccessful because the purchasing of unhealthy food is still up there, and also the kids, after they eat a healthy meal at school, they come home and binge on sugary drinks and junk food, undoing basically all the effort that the school system and government has put into feeding them healthier choices. So another reason is when New York banned the sales of large sugary drinks such as soft drinks or fruit juices. People rebelled, people petitioned, and ultimately it caused more of an uproar than it was worth, and you could still purchase more than one drink, or you could buy 2-liter sodas at the grocery store. So ultimately, the law that they created didn't really make a huge difference. It just made citizens upset. I believe government interference didn't work in this case because of free will. If someone wants to go eat something unhealthy, they will do it whatever it takes to get it. They will pay a higher price or wait till after school. So I don't think that was a great way to go about it, but that's how they tried to fix our obesity issue. On to the next point. If it's up to you to lead a healthy lifestyle or not. You can't force anyone to do anything they ultimately don't want to do, such as eat healthy or exercise. You can't regulate people's diets because they will find a way around it by eating things at different times or eating things in private. You really can't tell people what to do. It's up to them to make the decision for themselves and their families to make them healthy or not. Since it is up to the citizen to eat healthy, we should educate them and use our funding for education on health and exercise. I think that would really go a long way. We should be educating people on nutrition and exercise, and they can decide for themselves what to do with the information. Americans in this day and age have little knowledge of nutrition and exercise. We should become better educated in those subjects like math and reading. It's the same thing. With the information, people can make the choice for themselves and use their free will to either be healthy or not. In conclusion, I don't feel like the government should regulate exercise, and it is ultimately up to you to lead a healthy lifestyle. Today we talked about how we should go about fixing the obesity epidemic, and hopefully it is without government involvement. You should be able to make your own decisions for your health, and it is all up to you on how healthy you'll be.